Hi there, my name is Agnes Sponenburgh and I'm in group 11. Our group is discussing the benefits of a diagnosis-based treatment versus a symptom-based treatment. My group members include Mohamad and Jennifer. So I want to start off by talking about the DSM, which I think is beneficial to understand our topic. So the DSM, which I'm sure most of you might know, is it stands for Diagnostic and Statistical Manual of Mental Disorders. It is also used as the standard classification of mental disorders used by mental health professionals in the United States. So there are 5 DSM categories, including anxiety disorders, bipolar and related disorders, depressive disorders, feeding and eating disorders, obsessive compulsive and related disorders, and personality disorders. So this manual is used mainly to treat mental disorders. However, there are also multiple medical diagnosis books that physicians use to treat their patients, including the Merck Manual of Diagnosis and Therapy, which has 20 editions. So it's now in its 20th edition. So now that we understand what the DSM is and diagnosis manuals are, I feel like it's important to discuss diagnosis-based treatment versus symptom-based treatment, which usually work in conjunction with each other. Again, we know that symptom-based conditions are characterized by chronic or acute physical or somatic symptoms. So, and then a diagnosis is based significantly on laboratory reports or test results rather than the physical examination of the patient. So, for instance, a proper diagnosis of infectious diseases will usually require both an examination of laboratory test results and characteristics of the pathogen involved. And usually those go first with a diagnosis because that's like physical proof and evidence that we can read off paper. And then usually physicians will move on to like what signs and symptoms that their patient has to further diagnose. So one issue with a symptom-based approach is that physicians will take a symptom, like for example, like abdominal pain or other sets of symptoms, and bring them together to identify the potential disease or issue it could be. However, something like that, it doesn't exactly pinpoint what could be going on with the patient. A diagnosis is different than what you have, because it can a diagnosis is different because we know how we can treat it or how it probably can be treated instead of wondering or treating like multiple different diseases from having, like, say you have abdominal pain, we're going to treat it this way or that way, but with a diagnosis, we're treating it one certain way that we know is proven to work. So when it comes to prescription medications and which prescription a physician or psychiatrist will prescribe, they might first go off the diagnosis itself to understand which medication class the patient requires. Physicians that might follow symptoms after deciding on the diagnosis to aid in treatment decisions. So, like, basically my point here is that diagnosis-based treatment is used first to decide which treatment should go, how treatment should go. And then symptom-based treatment is used secondarily or sometimes not used at all to treat the patient. So, and then finally, one example I have is to talk about the diagnosis of bipolar disease. So, both my brother and my dad have bipolar 1, and however, my brother has a physical diagnosis, which has helped in his treatment regarding prescription medications. Having a physical diagnosis is very important to psychiatrists to understand how to direct treatment. However, even though my brother has a diagnosis, my dad does not, but he does have physical like symptoms of bipolar 1, and this makes it harder for him to get insurance coverage for certain prescription medications. which Jennifer is actually going to speak about the importance of having a diagnosis for insurance-related reasons. Yeah, and so because my brother has a diagnosis, it has helped him greatly in his life, physically and emotionally. So,
this is group 11. Our group is me, my name is Mohamad, Jennifer, and Agnes. And we're doing diagnosis versus symptoms treatment for DSM-5. And we're supposed to be for the diagnosis versus the symptoms. So let's dive in. Number one thing, the reason why diagnosis is really good compared to symptoms for DSM is schools receive funding for the children's diagnosis and the number of formal diagnoses. And this is really huge, especially because if a school receives more funding, that allows the schools to provide for the children and get the help that is needed for them. And there's people that can be benefited from the diagnosis or special services depending on the diagnosis. So families that don't have high income are allowed additional services and help needed that is special for them. And another thing, one of my references, it shows an example of why is Sally always the bad kid and act out of school. So instead of labeling as this, a DSM diagnosis label it as, and shifts the conversation to Sally's bit odd and has been challenging recently. Let's see what we can do to help. And Sally's behavior is attributed to her diagnosis and is no longer imaged as the bad kid, which has an impact on someone's self-esteem and self-image. So allowing a shift in the conversation and saying she's not been acting bad as a kid. She's just acting differently, and let's get the help that we can. So having this as a diagnosis compared to symptoms as in Sally's doing 1, 2, and 3, compared to Sally's just been acting different recently. So that helps a lot.
Hi, my name is Jennifer, so I'm going to be talking about a few more points. So having a diagnosis not only advises you on a treatment options and also advises you on future health risks, but tells insurance companies that you have a condition that's requiring medical care. And a doctor's diagnosis is also necessary to qualify for Social Security disability support or for job protection under the Americans with Disabilities Act, which helps basically protect the rights of your patient. So without a proper diagnosis when you have a mental health disorder, your insurance may not cover your mental health illness. In the past, your insurance might have paid about 80% of the cost of seeing your primary care doctor, but probably only 50% of the cost of seeing a psychologist. In 2010, though, this changed with the law being put in place saying that if a private insurance plan provides coverage for mental health and substance use services, then that plan is also going to have the coverage must be equal to that physical health services plan. So for example, if an insurance company cannot charge a $40 copay for office visits to a mental health professional, such as a psychologist, if it is only charging $20 copay for you to go see a medical or surgical office visit. This law also covers non-financial treatment limits. For instance, this limits on the number of mental health visits in a year, which used to be very common. This law, though, as essentially eliminated such annual limits, it does not prohibit the insurance company from implementing limits related to medical necessity, though. Also, the Affordable Care Act requires mental health and substance abuse to be included by all individual and small employer plans. So the Affordable Care Act also makes it illegal for insurance companies to deny you coverage for pre-existing conditions, including all mental health conditions. All Affordable Care Act plans must cover behavioral treatment, which includes outpatient individual counseling or group therapy sessions, diagnostic services such as psychological testing and evaluation services, ongoing outpatient treatment, including psychiatric treatment programs and medication management therapy. It also includes a substance use disorder treatment, which includes outpatient diagnostic and treatment services for alcohol or chemical dependency, medical services for withdrawal symptoms, and substance abuse recovery services. It also includes mental and behavioral health inpatient services, which covers inpatient mental health care if you're hospitalized within a psychiatric facility. So if you have a mental health condition that limits your ability to perform routine daily tasks and keeps you from performing work to earn a living, then you may qualify for disability benefits administered by the Social Security Administration, which is known as the SSA. The SSA has 2 disability programs. It has the Supplemental Security Income, which is known as the SSI, and the Social Security Disability Insurance, which is known as the SSDI. Both these programs have strict medical requirements, though, for the claim to be approved, though. So this is why we would need to have an actual medical diagnosis compared to only be treating your symptoms. So the SSA uses a medical guide, which helps determine if the claimant qualifies for the disability benefits. So there's a section within this guide that helps, that tells us about mental disorders, and it is listings for a variety of conditions, which include anxiety-related conditions, psychotic disorders, learning disabilities, depression, and many other different kind of mental health, issues. So each listing has specific criteria that must be met for the claimant to medically qualify per that specific listing. And you have to provide medical evidence that confirms your condition meets the criteria of the listing. So your medical record should contain your detailed physician notes, a confirmation of your diagnosis, which is important, which we're saying here, and treatment records and how your condition limits or restricts you. So as we can see from this, without that diagnosis, you're not going to be able to get these benefits. So as we can see overall from what we've talked about, there's many benefits from actually having a diagnosis treatment versus just having a symptoms treatment plan. So if you have any questions, please just let us know and we'd be happy to answer them. Thank you for listening. I hope you guys all enjoyed.